Coordinating Minister of Health and Social Welfare, Mohammed Ali Pate, has called for increased domestic funding for mass vaccination programs, warning that heavy reliance on donor support threatens long-term health security. He made the call while defending the ministry's budget before the House Committee on Healthcare Services, noting that recent health sector reforms have helped sustain immunization coverage with donor support. Pate disclosed that the ministry received only 36 million naira out of its 218 billion naira 2025 capital budget, blaming the shortfall on cash planning constraints and delays in counterparts funding. He added that the 2026 proposed budget aligns with national development priorities and was prepared using the GIF-MIS platform. In response, the committee chairman, Honorable Amos Magaji, requested full documentation of donor funds received and how they were utilized.
The last money that we had grant for vaccine financing was 2024. Even that was not complete. Yet we have continued to immunize Nigerian children to protect them from diseases. We have outbreaks that will protect Nigerians. We did a massive measles and rubella campaign, but the counterpart funding that Nigeria should put is always late in coming. How do you explain that? Now, naturally, these actors will use other technical partners, but we have to accept. But if we want to exit dependency, the best way to be dependent, to use your sovereignty, is to use your money and release your money, and then you have full control. But you can't want to control somebody else's money and without putting your own money on the table.
Some of those things we are still going to look at the budget, and if there is any need where we need to call the ministry, we'll still call the ministry before we sign it. One thing I wanted to understand is that for some of us that are even in the health sector, Abuja declaration was done in this country here. And then up to today, many countries have gone to move their budget up to over 15%. But for many years, the budget of health is still less than 10%. And our population is growing in millions. And we are dealing with a budget that is not growing in proportion with the population. So we need to understand that in budget. And many of the things, I'm quite aware, if the intervention we did in health institutions, if the budget of 2025 was fully funded,